In my first slide, I'm going to be explaining the healthy development of an embryo. So the first day of a pregnant person's most recent period determines the first week of pregnancy. A small amount of vaginal bleeding, sometimes referred to as implantation bleeding, may occur as a result of the embryo attaching to the womb wall in preparation for one of the following stages of development. The developing cells from around the 3rd week and to 10th week is referred to as an embryo. Here is referred to as an embryo, then after the 10th week it becomes a fetus. The embryonic stage is more popularly referred to as the first trimester. This is the stage when most of the important organs and functions are developed for the embryo, including the brain, heart, spine, respiratory system, digestive system and muscles of the face, which is why during this stage the embryo slowly begins to look more human-like. From around the 6th week, the embryo will start to have its own heartbeat. So here, you can see the whole way it goes up to 4 weeks, 10 weeks, 16 weeks, and then 20 weeks. Once the embryo is implanted into the uterine wall, four membranes are produced to support the development. The amnion, also referred to as amniotic sac. The amnion is the membrane that envelopes the developing embryo like a sac. It has amniotic fluid in it, which envelopes the embryo in the amniotic sac and shields it from harm while it is inside the womb. The yolk sac is a small membrane that provides essential nutrients during the 2nd and 3rd weeks gestation, while the key nutrient structures surrounding the embryo are developed. The chorion is an outer membrane that surrounds the amnion and gives the embryo more nourishment and defence. As the embryo develops, the chorion and amnion unite to form an amniotic sac. The chorionic villi emerges from the chorion during development and attaches to the blood vessels of the fetus. The allantois is a duct at the rear of the embryo. Its function is to dispose of liquid waste and ensure the exchange of gases between the embryos. The placenta is an organ developed during pregnancy. Its primary purpose is to deliver nutrients to and from the pregnant person to the embryo or fetus. The blood between the fetus and the pregnant person does not mix together. Instead, it is passed to the placenta, which distributes needed supplements back and forth. By the time the fetus has reached the 10 weeks gestation, the appearance of the basic human structures has begun to take form, as you can see here. At this stage, the limbs have begun to form from cartilage, as well as eyelids, ears, and general structure of the body. Between 11 to 15 weeks, the fetus is roughly 5.4 centimetres in length. From 12 weeks, the fetus skeleton is beginning to further develop and harden. The heartbeat can also be monitored in an ultrasound scan at this time. From 16 to 20 weeks, the fetus will grow approximately 11.6 centimetres to 25.6 centimetres in length between the weeks 16 to 20. The fetus starts to develop fingernails and a distinct fingerprint around week 17. The skin is protected by a white film called vernix from around 20 weeks. This will help protect the skin during labour and stop it from drying out when it's out of the amniotic sac. From 21 weeks to 25 weeks, the fetus will grow up to 34.6 centimetres, and during this time it will begin to grow eyebrows and eyelashes. The limbs will start to become more in proportion with the body also. From 26 weeks onward, the majority of visible appearance changes will have taken place. As the weeks go on, the fetus will just grow. During the 3rd trimester, weeks 27 to 40, the fetus will continue to gain weight and its organs will become more mature. The fetus will begin to practice breathing movements and its brain is undergoing rapid development, including the formation of billions of neurons and synapses. The fetus senses become more refined and they gain the ability to taste and respond to touch. The fetus will also become more responsive to familiar sounds and voices. Slide 3. Ultrasound imaging, whether it's internal or external, plays a crucial role in monitoring the health and development of the fetus during pregnancy. The two types are internal ultrasound, which is usually used in early pregnancy to confirm the presence of the gestational sac, embryo and fetal development. At the start of pregnancy, pre-12 weeks, the abdominal ultrasound may not be able to pick up a visible image, so this is a great option if it's an early pregnancy. This type of ultrasound allows for a closer and more detailed examination of the uterus, cervix and ovaries. It can also pick up abnormalities such as ectopic pregnancies, ovarian cysts and uterine fibroids. Because the internal ultrasound is taken closer to pelvic organs, the picture produces much higher resolution images. Then we have the external ultrasound, is the most common type of ultrasound used during pregnancy. It is performed at various stages of pregnancy to monitor fetal growth and development. At around 18 to 20 weeks, a detailed anatomy scan is usually conducted using this method. During the scan, you're able to evaluate the fetal anatomy, including the brain, spine, heart, limbs, and internal organs. In summary, both internal and external ultrasound imaging are valuable tools in monitoring the health and development of a fetus during pregnancy. They serve complementary roles in providing detailed anatomical information, assessing fetal well-being, and detecting any potential complications. Fundal height measurement is a standard procedure and is used to track the growth and development of the fetus during pregnancy. The measurement entails determining the distance between the top of the pubic bone to the top of the uterus, which correlates with the gestational age of the fetus. Some of the points need to be considered when using fundal height is gestational age estimation. The fundal height measurement is regularly used as a quick and non-invasive method to estimate gestational age during prenatal visits. By comparing the measured fundal height to a standardised growth chart, healthcare providers can assess if the fetus is growing appropriately for its gestational age. Detection of abnormalities. A large difference between the measured fundal height and the expected growth of the gestational age could be a sign of a possible problem, including amniotic fluid abnormalities, multiple gestations, macrosomia, which means a large fetus compared to the gestational age, or intrauterine growth restriction. If these abnormalities are detected, additional assessment and care will be required to protect the health of the mother and the developing fetus. Complementary assessments for a thorough assessment of fetal growth and well-being. Fundal height measurements should be combined with other prenatal assessments such as ultrasounds, fetal Dopplers, and maternal serum screening. These extra examinations offer more thorough data and offer in confirming or eliminating any possible anomalies found by measuring fundal height. Fundal height measurement is typically performed at each prenatal visit to track the growth and development of the fetus throughout the pregnancy. Consistent monitoring allows healthcare providers to detect deviations from the expected growth pattern early and intervene promptly if necessary. In conclusion, while fundal height measurement is a valuable tool in monitoring fetal growth during pregnancy, though it should be done in conjunction with other clinical assessments and tests, regular monitoring and appropriate follow-ups are essential to ensure the well-being of both the mother and the fetus. Slide 5. A Doppler scan is a helpful tool for fetal monitoring because it allows us to see the various body parts of the fetus and determine whether it's getting adequate oxygen and nutrients. The transducer is a probing tool that is used to send sound waves through the vagina or abdomen. Sound waves travel through the epidermis when they come into contact with the surface. The sound waves that are reflected back are transferred into images that can be seen on a screen as a waveform. Doppler scans may be recommended by a medical practitioner for various reasons like identification of slow fetal growth, previous miscarriage or stillbirth, pre-existing health conditions, lack of movement in the fetus, and preeclampsia. A uterine artery Doppler scan is used to examine the blood flow of the uterine arteries. The uterine artery is made up of two arteries that provide vital blood flow to the womb and enable the placenta to give the fetus the nutrients it needs. If a risk of inadequate blood flow or fetal growth is detected, a physician might suggest this type of Doppler scan. An umbilical artery Doppler scan is used to measure the rate of blood flow through the umbilical cord connecting the fetus to the placenta. It is typically carried out in the third trimester if certain conditions have been identified. A cardiograph is a specific form of Doppler which uses sound only to obtain information. This type of monitor is used to measure a fetus's heart rate. They are commonly used during labour for monitoring purposes. It is most often used when there are concerns or complications during the labour process. During labour, there are numerous checks that will be done to ensure the health of the fetus and the mother during the process of labour. The midwife will track the heart rate, temperature, blood pressure, urination and water content, the length and intensity of contractions and cervical dilation. Measuring the heart rate of the fetus is crucial in identifying their health throughout the stages of pregnancy. In stage 1 of pregnancy, the heart rate will be taken every 15 minutes and the second stages will take place after contractions. There are 4 methods of fetal monitoring during labour. Intermittent oscillation, which is the process of listening to the internal organs of the body using a stethoscope or ultrasound. This method is more regularly used with pregnancies that have no risk factors or causes of concern. Continuous cardiography is used to record the heartbeat of the fetus across a time period. This can be used over numerous hours to monitor continuously. This method is typically used for higher risk pregnancies. Electrical fetal monitoring examines the heartbeat of a fetus using ultrasound waves. A transducer device is used to observe the abdomen to continuously monitor and identify the heart rate of the fetus. Telemetry monitoring involves using a monitoring device on a pregnant person or fetus and connecting it to the CTG monitor. A CTG monitor measures the heart rate of the fetus as well as contractions in the womb. A birthing plan is a very individual and unique thing, as every single person may have different preferences and specific needs for themselves and their baby. Throughout a person's pregnancies, birthing plans can change, but usually a birthing plan will outline where the expectant mother would like to give birth, who they want supporting them in labour, the preferred delivery preferences like cesarean or water birth, vacuum delivery, forceps, or things like pain relief preferences, and if they're planning to breastfeed or bottle feed. It is important to remember that things like that are just the woman's preferred options, but during the pregnancy and labour, the medical professional may need to change things. Some people may opt to use the water to give birth in a birthing pool. This is absolutely fine for women with no risks to them, and the fetus, as the midwife, can use a Pinard stethoscope or a handheld Doppler to listen to the baby. But if they need to be monitored using cardiography, this cannot be done in the water. The induction of labour before 37 weeks gestation is referred to as premature labour. This may need to be planned in certain situations because of pre-existing medical conditions, or if they're carrying multiple fetuses, twins, triplets, etc. In other situations, this might happen suddenly, necessitating closer observation and possibly interfering with the procedures of the preferred birth plan. Identifying reasons why additional monitoring during labour may be recommended. Additional monitoring during labour may be required for various reasons, like high-risk pregnancies. Women with medical conditions such as hypertension, diabetes, heart disease are considered high-risk pregnancies. Fetal distress. Signs of fetal distress such as abdominal heart rate patterns, meconium-stained amniotic fluid, or decreased fetal movement may require additional monitoring. Induction of labour. Women who have an induction of labour may require additional monitoring due to the increased risk of complications and multiple gestation. Pregnancies with twins, triplets, or higher order multiples are considered high-risk pregnancies due to the increased likelihood of complications such as preterm labour, fetal growth restriction, and cord entanglement. Overall, additional monitoring during labour is recommended in various clinical scenarios to closely assess maternal and fetal well-being, detect any signs of complications, and facilitate timely interventions to optimise pregnancy outcomes. All expectant mothers will be offered additional screening for Patau syndrome, Edwards syndrome, and Down syndrome. Down syndrome, also known as trisomy 21, is caused by the addition of an extra chromosome in a person's genome. Edwards syndrome is also known as trisomy 18, and this is caused by an additional third copy of chromosome number 18, which affects the development of the fetus in the womb. This syndrome is considered life-limiting, and children born with Edwards have several health conditions that may affect the heart, respiratory system, and digestive system. Patau syndrome is also known as trisomy 13 and is caused by the additional third copy of chromosome number 13, which causes severe effects of the development process. Unfortunately, it's highly common on the Patau syndrome to result in miscarriage. The screening for these three syndromes is offered between 10 to 14 weeks. Gestation is known as the combined test, which involves an ultrasound and a blood test. During the ultrasound, they will identify and measure the area of the back of the fetus next. If a small amount of fluid is identified, then this is considered normal behaviour. If any excess amount of fluid is then this is considered normal. The blood test is used to identify any changes in the person's blood, which may assist in identifying a potential chromosome condition. The screening tests are only used to identify the chance and likelihood of a genetic condition in a fetus. It is not a diagnosis. If the chance of Down syndrome is identified from the combined test, an additional screening test may be offered. This is known as the quadruple test, and it typically takes within 14 to 20 week gestation. The quadruple test aims to test the likelihood by examining 4 key substances from a blood test: alpha inhibin 5, beta human chronic troponin, and estriol. If the chance of Edwards syndrome or Patau syndrome is identified, further tests will be offered. These tests aim to identify whether or not the fetus is affected by either a disorder or chromosome change. It is important for a pregnant person to know what the rate of miscarriage is. It is important for a pregnant person to know the rate of miscarriage after diagnosis test. This can be 1 in 200, so it is optional. The tests include choriobolus sampling, which can be used as a small needle to receive a placental tissue sample from the pregnant process. Sickle cell disease is a serious condition which can cause serious complications for an individual if not carefully monitored and treated throughout a person's life. It is caused by a mutation in the gene which controls the body's production of hemoglobin. Sickle cells are shaped like a sickle tool, which is a deviation from the normal red blood cell structure. These cells can be sticky or hard, which can impede blood flow by slowing the body's migration through the blood vessels. Symptoms of sickle cell include anemia, sickle cell crisis, and higher risk of serious infection. Screening tests are routinely offered to pregnant people, which allows for detection of sickle cell gene markings in the pregnant person. It is screened from a blood test that's typically conducted before 10 weeks gestation. Screening is optional for everyone, just like any other test offered. During sickle cell screening, both individuals involved in conception of the fetus can be offered testing for any genetic markings. If both people involved in the conception are carriers of sickle cell gene, there are several possible outcomes. A newborn baby birthed from 2 carriers may have a 1 in 4 chance of not carrying disease, 2 in 4 chance of becoming a carrier, and 1 in 4 chance of having sickle cell disease. If both persons are identified as carriers, further tests are offered to identify whether the fetus has sickle cell disease or whether they carry the disease gene. The rate of miscarriage after diagnostic tests can be 1 in 200. Fetal anemia is a condition in which the fetus has a lower than normal level of red blood cells or hemoglobin in the bloodstream. This can occur due to various factors, but is most commonly associated with hemolytic disease of the fetus, a newborn, also known as erythroblastus fetalis. The most recent case of fetal anemia is maternal fetal blood group incompatibility, particularly RHD or AMO incompatibility. In RHD incompatibility, if an RHD negative mother carries an RHD positive fetus, her immune system may produce antibodies against the RHD antigen on fetal red blood cells. These antibodies can cross the placenta and attack fetal red blood cells, leading to hemolysis, which is a breakdown of red blood cells. If fetal anemia is diagnosed, the next course of treatment must be made. One possible procedure is intravenous fetal transfusion. This is when the fetus is infused with a suitable blood type, which is usually O negative blood, via an injection into the umbilical cord, while an ultrasound is used to carefully monitor this. In the UK, abortions are only able to be carried out by a doctor in the NHS or with licensed clinics. Abortions are able to be carried out until 24 weeks of gestation, and then after this gestation, abortions must be only carried out if the pregnant person's life is in danger should a pregnancy continue. The pregnant person is a physical or mental harm or severe abnormality has been identified in the fetus. Before undergoing a medical abortion, a woman will typically have a consultation with the healthcare provider to discuss her options and confirm the pregnancy and be sure she understands procedures and risks. Medication can be administered for the abortion and involves taking 2 types of medication. The first is mifepristone, which works by blocking the hormone progesterone, which is needed to maintain the pregnancy. The next is misoprostol, and this is taken 24 to 48 hours later, and this causes contractions to the uterus, leading to the expulsion of the uterine, including the pregnancy tissue. Another option for abortion is surgical abortion, and this is usually performed in an outpatient setting such as a clinic or healthcare facility. There are different methods available, including vacuum aspiration. This is the most common method used in the first trimester, and is when a suction device is used to remove the contents of the uterus. Dilation evacuation. This method can be used in the second trimester up to around 24 weeks of gestation. It involves dilation of the cervix and removal of the pregnancy tissue using forceps. Miscarriage is the loss of pregnancy before 20 weeks gestation and can be very distressing and emotional time for expectant parents. There are several risk factors increase the risk of miscarriage. Advanced maternal age, which is usually defined as 35 years and older, is associated with a higher risk due to the increased risk of chromosome abnormalities in eggs. Women who have had previous miscarriages are also at an elevated risk if their potentially underlying factors can contributing to recurrent pregnancy loss. Medical and surgical interventions may be necessary to manage miscarriage depending on the circumstances. In case of incomplete miscarriage, where the body has not expelled all fetal tissue, medical management with medication like misoprostol or mifepristone may be employed to induce uterine contractions and facilitate the expulsion of remaining tissue. Surgical interventions such as dilation or suction curettage may be recommended for cases of incomplete miscarriage. These procedures involve the surgical removal of fetal tissue from the uterus and are typically performed under local or general anaesthesia. Hormonal support with progesterone may also be considered for women with a history of recurrent miscarriage or certain hormonal imbalances to help support early pregnancy and reduce the risk of miscarriage. Thank you for listening today. Does anyone have any questions?